Between January and December 2020, a total number of 5,009 cases were recorded through the National Gender-Based Violence Toolline 1195, and it is shown that there's an increase of 1,411 cases, making 36% of reported cases from previous year. Data indicates that Nairobi, Kakamega, Kisumu, Nakuru, and the Kiambu counties reported the highest cases of gender-based violence. Due to increased cases of GBV during the COVID-19 pandemic, His Excellency the President directed the National Crime Center to carry out a study to establish the causes of the increased cases and provide possible solutions. The findings of the study established that the number of GBV cases recorded between January and June 2020 had increased by 92% compared with the previous year, 2019. The study highlighted factors contributing to GBV as consumption of alcohol, drug and substance abuse, poverty, family and domestic disputes, retrogressive cultural beliefs and practices, poor parenting and upbringing, and moral dependency. Also, it identified the crisis among the youth who are experiencing identity crisis at the youth level, and also lack of adequate support as people struggle with daily life struggles. The most common form of GBV identified in the study were physical assault, rape, attempted rape, murder, sexual offenses, defilement, and sometimes by close known people, grievous harm, bodily harm, physical abuse, child marriages, psychological torture, and child neglect. In response, the government moved with resolve to mitigate and de-escalate the vice by deploying a multi-pronged approach. In September 2020, the Cabinet approved an interagency strategy that includes stakeholders to deal with the matter. 6 ministries are involved, and I named them: Ministry of Public Service and Gender, Ministry of Interior, Education, ICT, Health, and Labor, including county government, development partner, and NGOs and other non-state actors. Further, the government, in recognition of the contribution of COVID-19 pandemic to gender-based violence crisis, made an investment through social safety net cash transfers. Other interventions are through affirmative fund to provide support to self-help women groups, both men and women. As a result, loans to the tune of 300 million from Women Enterprise Fund, WESO Fund 60 million, Youth Fund about 80 million are dispersed today every month. And I want to emphasize that the government is giving close to have $1 billion every month to go towards supporting small businesses for the women, youth, and the people living with disabilities. We have a toll-free hotline, which includes the National GBV Helpline 1195, National Police Helpline, which is run by Police Care 0800730999. The Child Helpline, which is 116, which all these lines provide services such as anonymous reporting, assistance to the survivors, tele-counseling, and referrals for medical and legal services. 2, prevention and response structures through county GVV working group established by the national and the county government, which consists of the law enforcement agencies, especially the police, social workers, medical personnel, non-state actors to facilitate the prevention of gender-based violence. With the support of National Government Affirmative Action Fund, we have rescue centers for gender-based violence, which were established in West Pokot, Bungoma, Vihiga, Meru, and Migori counties. Additionally, there are 36 shelters operated by civil society organizations in 13 other counties. 4, we have continuous sensitization and awareness in the national and regional media and within the established national government administration officers, GAO, in partnership with other stakeholders. To this end, prioritized program targeting men, boys as allies, as advocates, role models, and change agents championing advocacy efforts against all forms of gender-based violence within the communities. Despite all these above interventions, we still have a long way to go. We recognize that the issue of gender-based violence is complex, it affects families, and government cannot win this war single-handedly. All sections of our society have an important role to play, whether big or small, in preventing GBV and save the society. No one is safe until we are all safe. Let us make it our responsibility to voice the gender-based in our communities, in our neighborhood. Today we share the following key important messages with the Kenyans. 1, Komesha Dhuluma, stop gender-based violence by using 1195. 2, any form of violence is a crime and is a wrong. Do not be afraid to ask for help. And the message is, let's break the silence on gender-based violence. If you feel unsafe in and around your home, if you are harmed or feel threatened, intimidated or harassed, walk away and also break the silence. 4, the lockdown and the curfews we are experiencing during the COVID pandemic are no excuse at all for gender-based violence. If we experience, let's break that silence even as we obey the curfew. 5, during the times of crisis, negative coping mechanisms such as depression can result to gender-based violence.
When did we as a society lose these things so much? That our girls and boys can't have dates anymore. That if you buy someone something, you must reciprocate. How is that really a society that we can live in? It is something that is very depressing about where we are headed as a country, and how people even on social media will hide and use this as an excuse and start blaming the victim.